Well, we've all been to the doctor's office. You walk in the room, you sit down. The first thing they generally do is slide the cuff on your arm and take your blood pressure while you're sitting there. It's been done that way for years. But a new study out of Harvard in conjunction with the American Heart Association says that's not the right way to take your BP, or at least not the most efficient. Instead, it should be taken while you're lying on your back. Dr. Umberto Campia is cardiologist and vascular medicine specialist at Brigham and Women's and assistant professor of medicine at Harvard. And Dr. Campia, we appreciate you coming in this morning. You've read through this study. What's your takeaway?
So overall, this is an interesting, thought-provoking studies. I don't think that the data are yet a game-changing situation. I would say that they indicate that there may be aspects of the blood pressure with the way that we take it or the way that we factor in our long-term risk control for patients who may develop heart disease. This aspect is now being put under more focus by this study. Still, the research on high blood pressure has been going on for over 100 years, and we need to incorporate these new data within the body of knowledge that we have. I think it is a initial work, but that will need to be developed and will need to have a lot of new data.
So you can look at it further. So you go ahead and slide the cuff on, because when you go in anytime, you sit down and they slide the cuff on. So when we have appointments now, is it going to change? Is this still the way that it's going to be done? Is this still the way it should be done?
Yes, absolutely. This study does not change anything that has been done. Whatever is available, the data that we have are still valid. We need to find whether the introduction of a different timing or a different way to measure the blood pressure is going to really affect the way that we have been dealing with blood pressure so far.
If you go in and you get your blood pressure taken, you can feel comfortable with whatever reading they give you if you're still sitting up?
Yes, you should. And there are very clear ways to do to take the blood pressure, and the guidelines specify that very clearly. They go as far as saying you should not cross your legs, or you should hold your arm on a table. You should not just hold it hanging. So,
So as you hit the button here, the question I would have for you then is, if people hear this study, they're going to go in and say, well, I heard I should be laying down on my back. Will that start to be incorporated into someone's exam?
I would say, first of all, the laying down would not just be laying down. People in the study were laying down for about 20 minutes. 20 minutes is the time that is allotted for a doctor's appointment.
Right.
So you would have to just devote 20 minutes for blood pressure measurement. This would not be feasible. So I would say, in specific situation, considering the blood pressure while the patient is laying down is
incorporated then maybe for someone at a high risk factor?
It would be a reasonable way to do it.
All right, so when we do go in to the doctor's office, if you you stub your toe, you have a headache, whatever the case is, the first thing I always do is take your blood pressure. Why is the emphasis on that? Why is it so important all the time?
So blood pressure is a silent killer. Blood pressure, some people think, oh, I have a headache. They check the blood pressure is high. Well, it's possible that the headache is causing the blood pressure, not vice versa.
Right.
So blood pressure is silent. If you don't check your blood pressure, you may have very high blood pressure not knowing it.
Right.
And years after years, the damage becomes irreversible.
What do we do here?
Oh, probably you were moving a little bit. Yes.
I have no blood pressure. It didn't register. Well, I will say that I do take medication and atenolol for the high blood pressure. I have a 25 milligrams. So the bottom line is there are safe and efficient medications to help you if you do have.
Absolutely. Blood pressure medications, we have 7 or 8 classes now that allow us to tailor treatment for each and every patient. Whether they have allergy to 1 or 2, we have a good alternative. And it's very unusual to have patients that do not respond to the treatments that we have now.
Well, interesting study. So if you're going into your doctor, you will be taking blood pressure the normal way, not lying flat on your back, probably for some time to come. And years of research shows that it's still very efficient and the right way to go.
Absolutely.
All right.